I will go ahead and get us started today. I am Leah Tallchief with CARS. Pronouns are she, her, hers. I am very excited to welcome everybody today for the second in the Medi-Cal Certification 101 series. Today, it's going to be a lot more group discussion on setting the funding landscape and then helping CBOs identify readiness. The CMET project is made up of our multidisciplinarian team, which can be seen here. We want to give a special shout out for Cal Mesa and SSG for helping lead this discussion and facilitate today. And then I will get started by introducing Trang. She's going to be leading the discussion today. She is with SSG, and I am very happy to pass the mic on over to her.
Good afternoon. Thank you. I'm Trang Huang with Special Service for Group. She, her pronoun. I want to also do a call out to my colleague, Lucero, who is with Cal Mesa, who presented in our first session and sort of help us get on the ground with the framework in looking at Medi-Cal certification. So for this session, we're hoping to start off with a little bit of a refresher in terms of thinking about Medi-Cal billing and Medi-Cal service within the framework of sort of the changing landscape and CalAIM. So we'll start with a little bit of that, and then what we'd like to do is have you break out into small groups. We see that there's folks from Northern California counties and then also San Bernardino, the Inland Empire. So we're hoping that folks, this is a learning collaborative. So we're hoping that folks from the county side, I see folks from DPH, Behavioral Health, DMH, and then also CBOs, fair numbers. So we'd like to use this opportunity for you in the small group breakout to be able to share your experiences, the challenges, as well as the success. And also if there are variations among the different counties, we're hoping that in that small group small breakout, that's gonna come up as well. And the county folks to help us, CBOs, to think about sort of the different variations that may come across. Then we also noticed that there's several folks who have registered and responded to our pre-session questionnaire with interest in looking at peer support certification and services. So we also will be having a small group targeted and specific with content related to that. And then we'll come back together to do a quick summary and also think about next step. I also want to note that the next session, which is the end of this month, we will focus on the nuts and bolts of Medi-Cal certification. We will have a specialist coming from the Department of Healthcare, the DHCS, to come join us, and they would be able to field questions and do a bit more of a presentation on the kind of the process, application, and some of the real nuts and bolts. For this session, we want us to think about our readiness. So a fair number of our participants here are CBO folks. So we want to have a discussion to think about where you are in the process. Some of you are early on and looking for funding. And I note that we have Angela Brand, who's also here with us, who's done some really helpful sessions on MHSA funding, and we also have the list of resources for that. So we will be kind of having you think about funding sources, your funding sources, where you are in that process. And then some of you are further down. You already may be having county contracts or potential county contracts, and you're thinking about how do I pull together my team and how do I prepare for the actual funding and the actual certification process. So hopefully in the small group, we will be able to kind of learn from each other's experiences. And in between the sessions, in the monthly session, we also are available for technical assistance where it's much more individualized. I have met with a couple of folks from different counties, and we have a individualized conversation around your unique questions and issues. And it would not just be myself, but we have the whole team of different community of different group agency members partners who would be available for individual technical assistance requests. So we want to also note that you can submit a request specifically, and that would be to the CARS team. So last session, Lucero had talked about the different types of funding structures. She talked about one of the options of specialty mental health services. So for this week, what we're going to do is have you think about, I wanted to pull out some of the types of services. So for mental health, some of the sample funding categories, if you will, includes prevention and early intervention. A number of you probably are familiar with that. You may already have funding with the county to do prevention and early intervention. Some of you may be contracted with a larger agency in your county, for example, to do outpatient care services. And so we want you to think about sort of the spectrum of the types of mental health needs, the going from a mild prevention, early intervention, moderate, and then severe, high intensity. So that would be full service partnership or possibly residential treatment center, and also crisis residential treatment center. So think about the continuum of care and the level of need that your client populations come in, and the types of services that you are able to offer. It's something for us to kind of broadly to think about. And those of you in CBOs who are already providing services, think about where you are and where you are looking for funding, or you're looking to get certified for what level of service. Could I get to the next slide? So we have a few resources. We have samples that I think Ayana has been sharing with some, and we would be making this available. Sort of a sample of a continuum of care grid for you to think about the entry point of service, like where your referral sources, who referred your client population, and also for you to think about your client population overall. What type of needs, what kind of level of needs do they have, what age group? We also have some resources on the county MHSA stakeholder process, specifically, like as I mentioned, and the care team, the CARES group, Angela Brand has done some work with kind of helping folks to have some webinars that's recorded that may be available for us to look at the different MHSA funding pockets and pots, if you will, and the stakeholders process. We also have some codes, some guidelines, samples for you. And for today, I want us to look at the CalAIM, some of the key changes and some of the CalAIM goals, if you will, because that is coming with payment reform coming in July. Our Medi-Cal billing and our Medi-Cal services will be moving and will be following that pathway. We also have a list of resources with CalAIM. There are a lot of moving parts right now with CalAIM. And so we have provided a list of resources, links for you to look. There's a list of providers, resources for the northern counties in California. There's a list of resources for the Inland Empire, for LA County. But one of the disclaimer we want to note is that as things are evolving and changing, please keep checking with the website. There may be handouts like this, which is really useful and helpful. This is by CalMesa. This is a really helpful handout overall to sort of give you an overview of CalAIM and the goals and some of the nuances, the types of services and billing. So, but please keep checking on the websites because things are unfolding county by county. There are lots of variations in terms of how counties are interpreting and how counties are implementing the different components. Even rates are being negotiated and are discussed as well. But for today's discussion, just again, quick review for us to think about Medi-Cal plans by type. So specialty mental health, a lot of, I think the participants today, the CBOs, this would be sort of where you would be looking at your services. So again, these are the types of services similar to my quick samples of the types of the continuum of care. And then the managed care plan, which is private insurance companies contracted with DHCS, non-specialty mental health, and fee-for-service providers, and then county drug Medi-Cal. So today, I tend to talk, I have to share that my work is in mental health from a CBO perspective. So please bear in mind that we will have, next session, we will have the specialist also talk about substance use treatment and certification. But just bear in mind that that's my limitations today, just for this process, this service. But this is really the grid that I want to kind of leave you with before we get into the smaller group. A number of you think about your services and you think about the types of services that you provide to your communities. And there are a lot of questions in terms of, well, who do I need to hire in my agency in order to provide services that is Medi-Cal billable? I think this grid is really helpful and the matrix helps you to think about, okay, I have LCSW, and then I may also have a vocational nurse. What types of services? So if you look here, there's a really nice kind of layout in terms of for you to think about your staffing pattern, what type of services they can bill, and what they can't. So this is something that you may already be doing or that you may consider. For example, certified peer specialist, you may say, I have 2 folks who are certified. Now, what kind of services can they provide and what can I be paid for? And then other types of categories as well.
We did share one resource, the website for the Department of Healthcare Service for peer certification. The frequently asked questions website has been updated, and so we'll share that link that Ayana and the team can send out as well. And there's a resource for individuals. The Department of Healthcare Service is responding to inquiries from the community as well as stuff that we've asked them about, and so there's a lot of good information there, that questions that come up pretty frequently.
We had someone in our group from Placer County Department, which was really helpful to remind us about the process, how the county goes out to do the review. So that's really helpful. And we're hoping to connect folks to different counties, to your county people. Okay, and other questions that comes up. We know that it's time limited, what we have to provide to you. And also, given that there's so many evolving situation with CalAIM, and also with each county, there's variations. Like in my group, I talked about kind of variations in terms of like the federal local match, the dollar match, right? And also the rates vary agency by agency, even within a county. Like the rate that the county contract with my agency, SSG, may vary from the Pacific Asian Counseling Service group, which is another agency down the street, right? So because of so much variations, some of your questions and some of the needs you have may be very nuanced to your county specifically. So the key in all of this is to make good friends with your county folks, your contractor, and over the years, once you get funding from the county, you will be assigned a county contract liaison. And that's the person that you want to keep connected to, because they will spell out what the county is asking for you when you do billing. They also be your liaison with the state in terms of the certification process, and also what's allowed and what's not allowed. And also chart audit. One of the things that happens is that there is audit of your work on a regular basis from the state. Now it comes through the county, but sometimes the state can choose to do it direct. I've had an audit directly before where they come directly to our agency and they reviewed our charts and our programs and policies and procedures. So part and parcel of funding and billing is always audit. And that is reviewing your work through the electronic health record, right? To see if, number one, you do what you say you do, and also are you billing correctly? You're not overbilling the system, and or that when you say you are providing a service, that your staff is paid also for the service. So there's all kinds of different auditing that they look at. But it is a way to keep us accountable, right? And it is a way for us to kind of maintain our quality assurance. Questions? Okay, so Leah just put in the chat again. Okay, we have a couple more minutes. Any other residual? Did we get a chance to share some amazing success or some tips, folks who are certified? Would you care to share any tips for folks who are just getting into the system? Is it worth it? Is it worth the work? It is an arduous process, but I think once you're certified, it is an ongoing, it really is an ongoing opportunity for your community that you serve. So if there's no question, I do want to make a plug for the folks who haven't had the funding yet, is to really go back and look at data. One of the things we want to encourage you to think about is how do you present your your client population needs? And so think about your population, where they live, what are the specific needs, what are the unmet needs in your population, and think about advocacy. There's been a couple of other good webinars on data use and advocacy, and really the time is to present your client population's needs to different stakeholders, both at the elected officials and also the county behavioral health folks. And also begin to look at smaller grants that may not be Medi-Cal pay, but it is a way for you to be, in LA County, we call it get on the master's list, right, with LA County. So essentially you have a record of contracting with the county. And that way it opens the door for future opportunities. Okay, so that's the data, to think about data and to think about, to really articulate your population's needs and the services that is needed for that population. And more, and also think about unmet needs. And this is where reducing disparity comes in, right? You're working with your community and you know what they need, but it's not being accessible to them. So that's kind of presenting and articulating that disparity at the different levels. And again, that connects to funding and looking for funding. And I think there are several folks who don't have the certification yet. And that's probably what you're looking at too, is ways to advocate for funding.
We wanted to thank everybody for attending today and thank our presenters and facilitators for being able to help in those group sessions. So thank you, everyone.